So now we get into a chapter, chapter 8, that is associated with our skeletal system and our muscular system. This is chapter 8 on joints. Now, don't get excited. We're talking about articulations, you college students. But what we're talking about here is where bones come together. And so what we're going to be doing is we're going to be looking at different types of joints, and we're going to classify them based on their, surprise, structure or function. Then we'll talk about some movement that occurs at these joints and using anatomical terminology to give us specific words for specific movements. And then towards the end we'll talk about some diseases and disorders associated with joints, because that does commonly happen with most everybody. Okay, so what we're seeing here is, like I said, two ways that we can classify these articulations. So we can do it according to anatomy, which is structural, and this is based on what's holding the bones together and whether a cavity is present or not. So a cavity, if you talk about it in terms of your teeth, may be a bad thing, but in terms of a joint, we're talking about a space that occurs in between the bones. So when we look at the structural types, there are three subtypes. So there are fibrous and cartilaginous and synovial. So those are the three types. Now when you look at those names, you might be able to guess the first couple in terms of what's holding these things together, or what's making up the joint where these two bones are coming together. But the third one maybe isn't quite so obvious. So we'll see. Okay, so those are structural, based on what makes up the joint. Then there's also functional, based on how the joint moves. So three different categories there, basically. We have synarthroses, which are immovable, amphiarthroses, which are slightly movable, and then diarthroses, which are freely movable, at least within the realm of the bones and their shape, which will allow it. So when we look at it, then two different ways of categorizing based on structure or based on function. So the structural classifications are a little bit easier to understand because we can see, oh yes, it has this type of connective tissue, this is how it's held together, etc. So we're going to start there, and then we'll kind of add on the functional classification, because we'll find, we said anatomy and physiology is often tied together, we'll find that there's a good amount of overlap between the three structural classifications and the three functional classifications. Okay, so structural classifications, three types: fibrous, cartilaginous, and synovial. Starting off with fibrous. So if we look at fibrous, what we find is we have fibrous connective tissue holding them together. That kind of makes sense, right? So when we look at that, no joint cavity, and most of these are going to be immovable, right? So they're basically like stitched together. So three different types of fibrous joints. We have sutures, we have syndesmoses, and we have gomphoses. Now I know these terms can be similar to each other, like we talked about, like syndesmoses and then synarthroses, right? So just be careful with the different words we're using. But these are three different types of fibrous joints. So it's like subcategories, like we were talking about. Structural, then fibrous. Now we're talking about three different categories of fibrous. So sutures are our first type of fibrous connective. So when we look at it, here's some of our cranial bones, and if we were to zoom up on it, we would see little fibers, little dense regular fibers that are holding these bones together. You can kind of see it a little bit maybe in the lateral view right there. So a suture is a good example of a fibrous joint, and as you can imagine, like we said, in Western medicine, these are considered to be, you think they're movable, slightly movable, not movable? Really, they're considered to be non-movable, at least in terms of Western medicine, right? So again, when we're looking at movement, what we're talking about there is we're talking about calling them synarthroses. So when we're talking about arthro, right, that's where we're talking about like joints and things like that. So these fibrous joints we consider to be synarthroses. Okay, so suture. And then what we find is syndesmoses. So syndesmoses, again, we have fibrous connective tissue holding it together, but it's a little bit longer, like we see here, between the fibula, the small bone, and the tibia, the large bone. So this is at the distal end, at the ankle joint. And then we have gomphoses. So these are also held by, what's the category? Fibers. And this is kind of like a peg and socket type of joint where we have the tooth sitting within the socket. So these periodontal ligaments that we see here are the fibers of this type of fibrous joint. And if you remember back in the Finding Nemo movie, right, it was all about the dentist's office and all the different fish and the pelican are all wondering what the dentist is doing and things like that. They're talking about the different tools he's using, and at one point the pelican flies in and asks whether they have loosened the periodontal ligaments yet. Periodontal ligaments. They were doing a tooth extraction, and he was wondering about whether these particular fibers were broken, right? Remove them. So, almost like homework, you can go back and watch Finding Nemo and have new depths to it. Alright, so these are fibrous joints, right? Part of the first of our 3 different structural joints. Then we have cartilaginous joints. As you would imagine, held together by cartilage, not highly movable. They tend to, they may be amphiarthrotic, may have a little movement, depends on what it is. Alright, 2 different types. Synchondroses, oh man, that's pretty similar as well, but if we look at that word, we can see chondro in it, refers to cartilage. And then we have symphyses. Now this should be somewhat familiar because when we were, for instance, looking at the pelvis, we found that there was a pubic symphysis, right? Okay, so synchondroses examples are the epiphyseal plate, right? Because this is hyaline cartilage. It's not really connecting 2 bones, but connecting 2 parts of the bone. And when we look here, right, at the first rib connecting to the manubrium of the sternum, we can see that we have cartilage there as well. So these are immovable, right? We'll find that the other ribs, when they attach, right, when you are ventilating the lungs, they are going to move. So it's a different type of joint. We have cartilage there, but still. Okay, so synchondroses. Then we have symphysis, right? We talked about the pubic symphysis right here, joining the 2 pubic bones, and we have the fibrocartilage discs, the intervertebral discs. So those both count as symphysis, and these are amphiarthrotic, meaning we get a little bit of movement. You can imagine a little bit of movement during childbirth, a little bit of movement in between these discs and the body of the vertebrae. Okay, fibrous joints, cartilaginous joints, synovial joints. We saw 3 subcategories of our fibrous joints. We saw 2 subcategories of our cartilaginous joints. And now we get to synovial joints. Now, synovial joints are the most numerous joints in the body. These are the ones that have a cavity that's filled with fluid, a lubricating fluid, and these joints are freely movable. So any type of movement that you can observe, synovial joints. Okay? So when we look at synovial joints, we've got some significant characteristics. We'll take a look at them coming up here. When we look at the figure, it's a little bit easier to see. So here's an example. This could be, again, between this phalanx and this phalanx, something like that. So here's our bone. We've got ligaments holding the bones together on the outside, on both sides. And then what we have is articular cartilage on the ends of each bone, right? That cushion. Then what we have is an articular capsule. So the articular capsule is going to be, that we see here, I'm not very good at tracing right now. That's our articular capsule. So it's a fibrous layer, and then on the inner part of it, we have a synovial membrane that secretes all of this synovial fluid. Synovial fluid has the consistency like of egg whites, so very, very slippery. As a matter of fact, a couple of years ago at Southern Dobson, they got a new cadaver, and Liz Chikar and I from Red Mountain went over there as a summer project and did the dissection of it. So it comes intact, and then you have to dissect it, separate everything out. So we did do a dissection of the left knee, and as you're dissecting into the knee, synovial fluid actually comes out. And even though you read about it being like egg whites, etc., I'm telling you, it's very, very similar. Next time you're cooking eggs, you're gonna remember it. Okay, in any case, synovial joints have synovial cavities filled with synovial fluid, lubricating fluid. Alright, so that's what we see here, synovial fluid. So these are important structures of these synovial joints. So you can see it's not just we put articular cartilage on there, but we've got a number of structures which hold it together, which cushion it in various ways. Now there are some specialized synovial bags as well, or bags of synovial fluid that occur as well. These are called bursae, or individual ones called a bursa, and tendon sheaths. So these ones are not necessarily right between a joint. We can see a synovial joint right here, but look over here. So you see these green structures here? So here's a tendon sheath. It's a bag with synovial fluid that's wrapping around the tendon. It needs some extra cushion as it's going around that shoulder joint. Here, we see a bursa, and again, that is an intact bag that we see right there. That's also forming a cushion between the acromion process up here and the head of the humerus. So those are some additional bags of synovial fluid that we can kind of stuff in different places to act as cushions. You hear about bursitis, right? Anytime you see the suffix itis, it's going to be swelling. Arthritis, swelling of the joint. Bursitis, swelling around the bursa. Tendinitis, right? You get it? Okay. So there's our bursa like we see right there. Now let's take a look then at the synovial joints in more detail, because we said that they're ubiquitous. They're almost all over the body. They're all freely movable, but that doesn't mean they all move the same. So some of the things that determine the stability and the movement of these joints can be the shape of the articular surface, right? So the shape of the bones, like the head of the femur and the acetabulum that goes around it. Also the ligament number and location. So like the shoulder joint, lots of different tendons and ligaments that are wrapping around it, helping to stabilize it. And lastly, muscle tone. So muscle tone, when we talk about ligaments coming across, right, that's bone to bone. Tendons are muscles to bone. And so like when we talk about the rotator cuff is 4 different muscles which help to hold the head of the humerus into the glenoid cavity. And so by keeping those muscles toned, by keeping them fit, that really stabilizes the joint more. Same thing with the knee, same thing with the foot. Okay, so table 8.2 goes through a number of different types of synovial joints. These are all synovial joints that you'll see color-coded as you get through it, right? So you can see synovial joints are the purple ones, and then cartilaginous joints are going to be the blue ones. So we see purple, and then we see blue, and we see purple, additional ones, right? And then here, we can see one of our examples of a fibrous joint. So it's just a good way to kind of have some examples right in front of you. Okay, so like we said, in terms of stability of joints, there are certain things that helps that. In terms of movement of joints, there are certain things that will allow that, which will help to support it, but also allow certain movements. So when we're talking about a joint, that's between at least 2 bones, and what we're going to have is we're going to have ligaments holding those bones together. We're going to have muscles that are spanning that joint. They're going to go over the joint so that when that muscle contracts, it's going to move those bones relative to one another. So what we're going to find is, like we said, we're going to have muscles that are moving the bones, skeletal muscles no less, and there's going to be a point where they attach on one end at least, 2 different ends, and then another end, right? There may be more than 2, but at least 2. And one of the ends is called the origin, and the other one is called the insertion. And the origin is the immovable end, and the insertion is going to be the movable end. So if you can imagine a muscle that's shaped like this, okay, and it's attached at 2 different points like that, when it contracts and it gets a bit fatter, like this, what happens is our second point, move closer to the first point. So up here, this attachment here is the origin, and this attachment down here is the insertion. Okay? They don't both move together and meet in the middle. One's stable, that's the origin, and then the other is the insertion. So when the muscle contracts, the insertion moves towards the origin. Now, if you're out on the limbs, it's a little bit easier to figure out because usually the insertion is distal and the origin is more proximal. But once you get to other muscles like, abicularis oris and ones on the torso and things like that that are going different ways, it gets a little bit tougher to call. But origin is the immovable end and the insertion is the movable end. Okay, so like we said, these muscles are going to be moving the joint, and they're going to move them in different directions. And the directions are going to be determined by the shape of the joint and things like that. So when we look at the bones and how they're shaped when they come together, it's going to allow them to move in different ways. And there's a range of motions in terms of which directions they can move. One is non-axial, basically slipping movements like this, okay? Then there's uniaxial, like a door hinge, right? A hinge joint. It just basically moves in one plane like this. You start doing this, that's up here at the shoulder. But this hinge joint of the elbow only does one thing. It goes in this plane like we see right there. That's uniaxial. Then biaxial is two planes. And then there's multi-axial, like the shoulder, ball and socket joint, that can go all over the place, right? So that's multi-axial, like we see there. Okay, so when we look at them, when we're starting to categorize the movements that occur at these synovial joints, we find that it subdivides into three different categories. There's gliding, like we said, which is kind of that, if you will, non-axial. Then there's angular movements, like we said, which are going to be things like uniaxial, etc. There may be biaxial, it may move that way and that way. Talk about like condyloid joints and things like that. And then there's rotation. So rotation, right, is pivoting like this. Okay, so let's take a look at some of the gliding. So one bone glides over the other. An example are some of the wrist and the ankle. So when we're doing these types of movements, right, these gliding movements, we're looking at the movements of these carpal bones sitting in between the radius and the ulna. And those little bones are gliding ever so slightly next to one another. Okay, angular movements, we're going to see an increase or a decrease in the angle between the two bones. Now here's where we're going to have a lot of different definitions in terms of movement, right? So you can't just say, oh, well, you know, I moved my elbow. True, you did. But if you're taking notations or whatever in your chart, you need to know specifically what type of movement we're making. So we're going to see some specific definitions like we did with anterior and posterior and medial and lateral. We're going to see these paired terms for different specific movements. So for instance, we start out with flexion and extension. So flexion and extension is when flexion is decreasing the angle between the bones and extension is increasing the angle. Okay? So you can do that, you know, with your neck, right? So flexion, we're decreasing the angle. Here we're at 180 degrees, and now we're going to decrease that, okay? Then when we bring the chin up again, we're increasing the angle here. So flexion and extension. So flexion of the wrist joint, flexion, we're decreasing the angle there. Extension, we're increasing it again. Flexion, extension of the phalanges, okay? We also have hyperextension. So hyperextension tends to go beyond 180 degrees. So when I bring my head back up and I'm vertical again, now I've done extension. If I go back here beyond 180 degrees, that's hyperextension. Many joints you don't want to hyperextend, but other ones you can, like the neck, even like the torso, right? Doing sit-ups, flexion, you're flexing the torso, extending the torso, hyperextending instead. You can see some other examples as well. So you can see the shoulder joint. With the shoulder joint, picture this is your 180 degrees, right? With your head and neck and going to the torso. And when you bring your arm up, right, we're decreasing this angle here between the upper limb and the rest of the straight. So then extension is when you bring it down to 180 degrees again. Same thing with the knee. We can see if we're considering this the straight line, when we're decreasing it like this, that's going to be flexion. And extension is going back to 180 degrees again. Don't want hyperextension. Don't want to walk like a chicken. Same thing with the arm, right? We saw flexion going this way. Extension is going to go back the other way. When we go beyond 180 degrees, we go to hyperextension. So lots of different examples of flexion and extension. We also have abduction and adduction. We'll see that here. So these are opposite to one another, antagonistic. So adduction, ADD, is this is when you're basically, you know, squawking like a chicken and getting your arms going, etc. So when you're doing that chicken dance, all this type of thing, when your upper limbs are coming down and you're adding to your center mass again, that's adduction. You're adding. And abduction is when your limbs are going away from you. You can do it with your lower limb and you can do it with your upper limb, right? You can even do it with your fingers, right? So adduction, we're bringing them together. Abduction, when, don't like to think about it, but when a kid is abducted, right, it's going away. When they get rescued, they're added back to the family. They come together again. Okay, that's why when you go to the gym, right, there's an adductor machine, right? You have adductor muscles on the medial aspect of the thigh for bringing the legs together. Okay, we also have circumduction. Circumduction is interesting. Circumduction occurs at a ball and socket joint, and we said this is rotation, right? That's rotation. Circumduction is when you are, if you were writing on the board, you'd be drawing a circle, right? So you're creating a cone of movement as opposed to just pivoting on one axis. Okay? So again, rotation. And then there is what's called medial and lateral rotation. So if you're talking about like the lower limb, right, or even the shoulder, medially rotate it, you're going to bring it in like this. Laterally rotate it, you're going to move it to the side instead. Then there are some special movements as well. Special movements, supination and pronation, have to do with the hands. So it involves a number of different joints, so they give it a specific name. But basically this type of a movement is going to be pronation and supination. And the way that you can think about it is supination, when you do this rotation, your palm comes up like you could carry soup, that's supination. And then pronation is if you were kind of dumping out the soup. Another way to think about it too, so you hear about laying prone and supine. Remember anatomical position? I have to do my contracted anatomical position here. Anatomical position, hands out to the sides, palms facing forward. If I'm laying prone, right, I'm going to be face down. If I'm laying supine, I'm going to be face and hands up. So if I was sleeping, I could hold a cup of soup. So that's laying supine, when you're laying on your back and your palms are facing up. There's also some specialized actions when we get down to the foot. So tapping your foot to the music, right? When your toes come up, that's called dorsiflexion. And when your toes go down, that's called plantar flexion. Bottom, the sole of the foot, is called the plantar surface, so plantar flexion. When your toes hit the ground, plantar flexion. When they come into the air, dorsiflexion. Okay, inversion and eversion. Imagine if I was standing on my hands, doing a handstand, right? If I turn the palms of my hand in like that, that would be inversion. So imagine the soles of my feet. If I step in gum and I'm turning it in to look, that's inversion. The sole of my foot, the plantar surface of my foot is facing in, okay? As opposed to eversion, where it faces towards the outside. Okay. Sometimes you'll also hear pronation and supination with the ankle as well in the foot. But you can see that it's a little bit like the hands, right? If you were going to try to hold a cup of soup, you might turn the palm of your hand, or you might turn the sole of the foot inwards like that to try to hold the soup. So sometimes that inversion, they're called supination as well. You're talking about runners and everting their feet and inverting their feet, or pronating, over-pronating, and then supinating. Okay? Okay. We also have protraction and retraction. So oftentimes, so this is more of a horizontal movement going out and coming back in, right? If you want to retract a statement, you're going to bring it back in. And if you're going to protract, to protract something is to kind of basically push it out like that. Other specialized movement, elevation and depression. So you can do that with the shoulders too. Elevation, depression, pretty straightforward. Opposition. So opposition, bing, 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 right? You have opposing digits that are coming together. Okay, so we'll stop here for the first part of our chapter 8 on joints. Remember, we looked at classification based on structure, based on function. Those are the key parts. Then, once we got to synovial joints, we started talking about the different parts of a synovial joint because they were more complex, and we started talking about the different types of movements, right? Non-axial, uniaxial, biaxial, and then, right, multi-axial. And then we got into specific names for particular movements, like angular movements and rotation and things like that. So the last thing that we'll do in this chapter on the next part is we'll talk about specific joints that have a lot of detail to them that we'll be looking at in lab, some of them. We'll talk about some of that detail as well as some injuries that occur associated with these freely movable joints.